People with long-term disabilities with multiple prescriptions can often find it challenging to manage their medicines. Health professionals sometimes recommend pharmacies repack patients' medicines into multi-compartment compliance aids, shortened to MCAs, also known as dossets. But use of MCAs can lead to unintentional harm. Did you know there is actually a higher risk of error during the dispensing of MCAs because the medication is taken directly from the original packaging and repacked, thus introducing more potential for mistakes to be made? Furthermore, medicines prescribed to be taken only when needed are often inappropriately included in an MCA or forgotten about and not taken at all. Patients are less likely to understand which pill treats which condition. It is because of these factors that it is recommended MCAs are only used after a pharmacist has discussed with the patient what works best for them. This is June. June is 84 and has just been discharged from the hospital after having a fall and feeling dizzy. June has multiple medical conditions. Because of her conditions, she is registered as having a long-term disability. The hospital prescribed Stemetil to help with her vertigo. She must take one tablet 3 times a day and start reducing once the symptoms ease. This is on top of her usual other medications. June was discharged from the hospital with all her medicines for that week organised within an MCA. After a few days at home, June goes to see her local pharmacy team. Sarah, the pharmacist, knows that June lives independently with a bit of support from others. June tells Sarah that since she's been home, she's found it difficult to go to the toilet, even though she's drinking lots of water as she has a dry mouth. Sarah asks June about the pills in her MCA and whether she reduced the Stemetil as instructed, as these sound like possible side effects. June tells her she's been taking all the pills in the compartments for that day. She couldn't remember which was the one that stopped the dizziness, so just carried on taking them all. Because June has a long-term disability, Sarah talks through an assessment tool with June to work out what help she needs to take her medicine safely. She asks June whether she has any issues swallowing her medication. She assesses her dexterity, her vision, her understanding of her prescriptions, and her memory. Sarah finds out that June struggles to open her medication packets and sometimes forgets which pill to take and when. Sarah shows her an easy way to get the pills out of the packaging and shows her how to use a medicines reminder sheet to organise them. June is thrilled. She wasn't confident taking medication out of an MCA, she much prefers knowing which pills relate to which condition. Community pharmacy teams have many solutions to support patients taking their medicines safely. It is a pharmacy team's responsibility, through discussion with the patient, to assess and suggest reasonable adjustments. Less reliance on pre-prepared MCAs will also improve patient safety, empower patients to understand their medicines, and reduce waste in the system. Next time you think a patient needs support taking their medicines, ask them to talk to their community pharmacy team about all the options available.